is David Bruggeman. I am a strategic advisor with SlicedHealth. We appreciate everybody making some time for us today. Our topic today is revenue you can't see. That's revenue you'll never collect. And we're going to apply that towards how AI is benefiting revenue cycle management today. So on the actual, our speakers today, I'll be moderating. Alex, would you go ahead and introduce yourself?
Hi, yeah, I'm Alex McManus. I'm the Chief Technology Officer here at SlicedHealth. I've been in healthcare for about 15 years. Most of that has been in development roles at various electronic health record vendors. So a lot of my career has been focused on implementing and supporting government mandates. So early on, it was meaningful use, and then 21st century cures. And here at SlicedHealth, I've been real focused on price transparency and no surprise billing act. So that's really what brought us down the road to create a contract management solution in the first place. And yeah, happy to be here with you.
Thank you, Alex. Reese?
Hey, good afternoon, everyone. I'm Reese Walker. I'm the Chief Product Officer and a co-founder of SlicedHealth. Been in healthcare IT about 20 plus years. Most of it spent in revenue cycle, system support, and as a financial analyst. So I appreciate everyone being with us today.
Fantastic. Well, just a couple house-cleaning items. We're going to allow you to ask questions. Hopefully, if we have some time at the end of this, we'll get to those questions. If we don't, we certainly will do some follow-up after the webinar is completed. We're going to try to get you guys, everybody out of here in about 45 minutes to give you a little bit more time back to your day. But we'll go ahead and get it started with some questions. I'll start with Reese. Reese, how would you describe the difference between traditional revenue cycle processes and one supported by AI?
Oh, so I would say, all of your RCM processes, especially back end, are very reactive. Everything is to you wait for denials and underpayments and variances to come in, and then you'll chase those down manually, either through manual reporting or running a work list in your billing system. And it's all very rules based. If if you see X, you do Y. And the problem with that is payers are constantly changing X. So with AI, it's much more adaptive, and it's able to learn patterns in claims and payments and in contract terms at a much quicker and faster pace than you would ever be able to do manually. And so really, instead of relying on static logic that's built inside of these archaic, not archaic, but the legacy systems, when you start applying AI, it's continuously refining itself. And so that's one of the biggest benefits that I see versus traditional RCM versus a AI capable RCM. It is really, with traditional RCM, you're always seems that you're fighting fires, and with AI enabled RCM, you're able to prevent much more of them on the front end. So that's kind of how I envision this AI enabled RCM to be much more adaptive and reactive than it is, just the old logic that exists in a lot of the platforms now.
Okay. Yeah, and I guess, tying that back into what we're seeing now as far as the most impactful ways AI is transforming RCM compared to traditional methods. Is there anything else you can put on top of that?
Well, like I mentioned, the speed and the capability of the quickly adaptation of what's happening. Really what takes hours and days to learn and refine and research, AI can do it in seconds. So when you're, even if you're out searching websites and looking at CMS guidelines and things like that, you may spend several hours trying to search for a rule or something or a regulation where AI can find it immediately, even if it's not already in the LLM that you're using. And also the accuracy. You can really depend on AI to give you verbatim, and there's no bias in it. So that's one that's one benefit. Also, I think instead of spending a lot of time searching for issues, AI can bring those to the forefront immediately, and you spend much more time actually fixing them. So on the analytics side, we say instead of doing all of this data wrangling, spend more time actually analyzing your data. Well, it's kind of the same thing with AI. Instead of spending a ton of hours looking for issues, spend much more of your time fixing those issues. So looking at things like your coders, your builders, your analysts, they can focus on that much more high value task than actually just searching through claims and remits and payments, trying to find, well, what do we need to work on today?
Okay. I mean, you brought up the fact of AI impacting speed and accuracy. Can you try to provide a little bit more detail on the workload? Obviously, everybody is talking about AI and how it can replace people. I think what we're seeing more in the industry is the impacts on workload and efficiency. What's your thoughts on workload?
Yeah, absolutely. We would never try to go in and use AI to replace someone. What we want to do is make them much more efficient. And it's one way to increase scalability without having to add headcount. So everyone would love to have double the amount of builders, double the coders, but AI gives you the ability to actually increase that without adding headcount. And so by making people more productive, more efficient, like I said, being able to what would normally take hours or days, you can do it in a matter of seconds or minutes, is really how you affect that productivity.
Great, thank you.
Yeah.
Alex, you're actively involved in the development of AI and the Slice platform. What trends are you seeing in the creation of AI tools across healthcare?
Yeah, I think early on you would see a lot of focus on the clinical side, hydrating clinical notes, integrating with the HR to kind of populate those notes a lot better. I think now with the more agentic AI becoming a reality, you're seeing a lot more focus in the RCM side. So you can have agents that are specialized in appeals generation, agents that specialize in underpayments, and then kind of orchestrating these agents is kind of going to become a lot more of the bigger problem, the bigger innovation in AI across healthcare in the coming months and years.
Yeah, and tying back to that, as far as being a product solution vendor to healthcare, what's your thoughts on the ultimate goal of bringing AI to our industry?
Sorry, that was to me?
Yes.
About bringing an AI product.
Yeah, I mean, as far as being that you're developing products for SlicedHealth, and it's impacting the revenue cycle side. What's your thoughts on kind of like the ultimate goal when you're thinking about bringing AI into healthcare as a whole?
Saving time, maximizing your efficiency in a shorter amount of time.
Okay. Yeah, and I love the word efficiency. It really seems to be a clearer definition as far as what AI's value is to our vertical. Reese, back to you.
Yep.
Everyone has access to AI now. How is SlicedHealth's approach different? Why isn't it generic, off the shelf? Talk a little bit about the safety of bringing AI into rev cycle.
Yeah. So I think one of the biggest differences between off the shelf AI is those models are trained on open internet data. And a lot of the data that we deal with in healthcare is private and personal. Healthcare contracts are supposed to be proprietary. Payer logic and claim level detail. PHI is involved, and none of that can be publicly available. So when you build AI around healthcare, you still have to follow all of the PHI and HIPAA compliance. You can't take a patient's claim and remit and copy and paste it into ChatGPT and expect it to give you what you're looking for. We have to make sure that we're using the contract logic in place, and so that's proprietary to our client. We have to make sure that we're compliant with all of the HIPAA and PHI stuff. So, that off the shelf is not going to be useful. Now, the public available data is what are your CART codes? What are your reason codes? What is the CPT code? That may be readily available in an LLM, but being able to match that up against your proprietary data is not going to be available. And then also, when you build a platform, you want to make sure that it's traceable and, kind of see how and why it made a decision, because a lot of that logic is needed in order to file an appeal or have a conversation with a patient or have a conversation with someone else in the hospital, the billing or medical records department. So being able to trace that is very important as well. So, that's kind of the biggest difference between your off the shelf, and I think now if you even look at Chrome browser, you can see there's a link to start using Gemini on everything you do. Well, it says right there, anything you do is going to be added back to the public knowledge. And you just can't do that with healthcare data. So you have to make sure that everything is secure. And, I'm definitely not the expert on internet security and all that. Alex would be way more first on that than I am. But I just know that's one of the things that we take very seriously when looking at this stuff.
Very insightful. I think that, AI is still relatively new, but being able to have your own siloed approach is highly critical. I mean, that's part of that whole, if you're going through an AI audit or security audit review, that's a critical component of that.
Absolutely.
Let's switch subjects a little bit and look at it from what's the value add to KPIs when you're looking at an AI solution, particularly as it relates to rev cycle. Alex, if you had to measure AI's value in metrics beyond dollars, what would it be specifically in rev cycle and contract management?
Time. Time is the one thing more valuable than money is time. So that's definitely, I think, that the biggest win with AI is it gives you back your time to focus on what's important. So I'd measure it in hours or days.
Yeah, I'll kind of go off just a little bit off script on this one. When we start talking about time, I think it's also how do you implement AI? What's the impact as far as an implementation is concerned, particularly as you're looking at, a SaaS vendor's solution like SlicedHealth? Can you talk a little bit about, what kind of impact is it going to be on an implementation by starting an AI solution?
For implementation of our clients, like onboarding?
Correct.
Yeah. So that's definitely, that's really where we initially started with AI. It was trying to have a large impact on our internal teams and implementing and onboarding clients faster and smoother. And now we've kind of brought that to the user-facing perspective as well.
Yeah, I'll also say that
Go ahead, Reese.
The impact is fairly minimal because we have taken and applied AI into our platform where all of the other logic existed. So there's no additional really setup in order to use the AI. We put it right in the workflow. So when we're looking at our claims analysis, it's right there to help you. When we're looking at our contract modeling, it's right there to help you. So, the impact, it almost enhances as opposed to impedes what you're trying to accomplish.
Yeah, that's tie that in back. Go ahead, Alex.
I was just saying, yeah, exactly. Well said.
Okay. And Reese, just to spin off that a little bit more, how can AI help hospitals find breathing room when margins are thin and staffing is tight?
Yeah. So again, we can't talk more about giving back that time. I think also AI doesn't get tired. It doesn't fatigue. So it can sit there and find those repeated patterns where a user would get, an end user would get tired, get burned out. So it's there. It's already always willing to do and ready to do what you need it to do. So I would say that it definitely even helps kind of burnout. Like I remember when I was at a hospital and, we had to do things every month. And if you can use AI to help those repetitive tasks, that also helps prevent burnout from staff. And then again, the time that it gives back is one thing. And then another is, finding those small leaks in your revenue cycle that you normally wouldn't identify until it becomes much larger. Well, you can do something about those ahead of time. So, if you're looking for something, you're always looking for the $10,000 to $100,000 issue. But what if it finds $1,100 issues? So that's something else that you're able to do. And even if you finding it earlier also. So, when people start looking at like hard dollar ROIs and things like that, well, what if you actually prevented something and you wouldn't have known about it until it was 6 months down the road, and now it is $100,000 problem, but AI actually caught it when it was only a $1,000 problem. And so there's also, things like that where you're able to find the small leaks before they become big losses.
Yeah, I like the analogy where it doesn't ever take a sick day, and that virtually AI basically gives you a digital assistant. We all would love some help in our day-to-day activities, and having that assistant to help us with some tasks certainly provides value there. Alex, quick question here. What's the learning curve for a team adopting AI for the first time, particularly around contracts or payer processes?
Yeah, I like to kind of think of approaching AI as it's really like an iceberg. You really only see a little bit of the complexity of it. So when you start to get in there, you're thinking, oh, just integrating with a large language model. But in the end, it's really, you're integrating with one large language model to get the intent of a question, and then you're routing it to another large language model based on that intent. So it gets really complicated pretty quickly. There's a lot underneath the surface that you don't realize at first. So yeah, some of the initial hurdles for us was getting through OCR, for instance. That's real specific to contracts. So we had to really work hard to build a good OCR solution to feed into the AI.
Yeah.
And then there's payer specific logic is always complicated to get right.
Okay, but yeah, I mean, as far as the impact to the end user themselves, the hard work has actually been done by the vendor. Is a way to look at it, right?
Absolutely, yeah. I would definitely recommend partnering up with a vendor that's done all the research for you. Because yeah, if you're trying to get in from the ground up, it's going to take a lot of research investment.
Okay. And Reese, how do you know if your AI investment is actually working? What early indicators should the clients be looking for?
Yeah. So when you're talking about early indicators, I mean, everyone wants to use like an ROI or something like that that's financial tangible, but a lot of times that's lagging. You won't see that for several months. So some of the early indicators are things like how's your denial workload looking? Is it trending down? How is your team spending less time doing the task that they normally do? Are they able to touch more claims? Are they able to get through their work list at the end of the week, where they used to not be able to touch everything they needed to? And then are your variance reports and are your reports looking better every month? And then really AI should clean up a lot of the noise and the tasks that have to be done to be able to fix problems. Again, it goes back to that, spend less time analyzing and more time fixing the issue. So if you have less noise and less of those tasks involved for you to act before you can actually fix an issue, appeal a claim or refile a claim or appeal a denial, is all of that accumulation of data becoming less burdensome. And so that'll definitely tell you if your AI investment is working outside of an ROI.
Okay, it's fantastic. I'd like to actually maybe switch topics again and get more into how AI is moving from reactive to proactive as it applies to RevCycle. And how are hospitals using AI to extend their team's capacity to do more with limited staff? We all know that there's staffing is a huge issue in RevCycle. How can we've talked a little bit about efficiency, which will obviously enable staff to generate more output. But I'd like maybe get a few specifics wrapped into that question. Alex, looking at it from the SlicedHealth perspective, why did Slice choose to develop and bring AI into the platform? What were the gaps that we were trying to solve?
I think it was just a natural evolution to our product, and it really initially what we were trying to solve was helping us more efficiently build contracts in our contract management system. Now it's a lot more around not just that, but also providing the user the information they need to take action.
Yep.
Okay. Yeah, and I would say for those that aren't familiar with contract management as it applies to managing RevCycle and managed care contracts, the most time-consuming part of the implementation is actually bringing those contracts in and how you apply that logic into managing underpayments and denials. So basically the implementation has been positively impacted by the introduction of AI. Reese, how does traditional reactive solutions move to proactivity, and how are you moving it to the front of the line?
Yeah, so I mean, obviously the goal of every RCM department, whether you're in a hospital or a practice or whatever the case may be, is let's stop being reactive and be more proactive, right? Let's stop chasing our money and do a better job protecting it to begin with. And so normally you have tools that look at the remits, and then you have to go and do something about that remit or something. But if you could push that more before the claim is even billed, you identify those risk factors like coding, missing modifiers, and contract conflicts. If you can get those up front, that's really where the benefit really becomes more of a proactive approach to this. So moving insights closer to the point of the event. Is it registration? Is it coding? Is it billing? As opposed to after the payment comes in. So really that's like I said, that's the difference between chasing your revenue versus protecting it. And that's really where we want to get to, where we're helping folks protect their revenue. So it's really not even to the end goal would not be to be able to react faster. The end goal would be able to make revenue loss eliminated, which is pretty lofty goal, but the closer we can get to that and help our clients, the better.
Yeah, and just to parlay off of that response, how do you see roles changing and evolving? So the people that are working within RevCycle currently without an AI solution, what do you see? How does it look different?
Yeah.
With the implementation of an AI solution?
So there is some change involved, and I know a lot of folks in RCM are sometimes resistant or scared of change even. But it is, once folks understand that it's not trying to take their job, but just trying to enhance it and transform it and make them more efficient. You can, like I said, you can use the AI instead of becoming a data hunter and trying to analyze all of that data. Just allow it to do your job quicker and allows you to focus more on resolving the issue than finding the issue. And then of course, just being able to have more intelligent data, and what you're looking at, and just work smarter and faster. And, they always say work smarter, not harder. So that's really the goal of AI in a nutshell.
Well, I will certainly volunteer myself as an agent against change for sure, but I'm starting to see the benefits of AI myself, and it is making some of the activities that I do on a day-to-day basis a lot more efficient. So that can only be a benefit for all of us. Alex, how does having AI as part of the team revolutionize contract management capabilities?
Yeah, it's having an expert at your side, helping you with all of your daily tasks, telling you, recommending what your next action should be, but also recommending workflow changes, things like that can fix problems upstream, like Reese was mentioning.
Okay. Yeah, I don't know. For those of us that have been involved in it and having all the coding books and all the physical documentation required to do the job effectively was not only a huge drain on space, but also a huge drain on time. So I think that AI is going to help automate a lot of that as well too. Just a few more questions, and then we'd like to open it up for the audience to ask some questions as well. Let's look at AI into the future. How do you see AI reshaping revenue cycle over the next few years? What should hospitals be doing right now to prepare? And I'll put it up to both of you guys just to have a dialogue about that.
I'll let you start it off, Reese.
Oh, thanks. I think definitely one thing you'll see or should start to see is people having an AI policy within their hospital. They have a HIPAA policy, they have a risk management department or somebody that helps them with that. A lot of them will start probably having AI, and they will, again, that utilizing a public-based LLM is very dangerous in healthcare. So I wouldn't be surprised if people started, I don't know if it's possible, Alex, but can you cut off the ports that are used, in your firewall and things like that, cut off those. So I think, using AI to help you write an email is one thing. Using a public AI product to help you do claims analysis is probably not a good idea, because there is the risk of exposing sensitive data to the public. And so, you can't just use, it's got to be much more thoughtful in how you do that. I think also, when you start using AI, you've got to have something that has been trained on HIPAA, has been trained on payer language and revenue cycle process. And so using the prompts that are built within our platform have very strict guardrails around it to try to eliminate hallucinations and things like that. And so, I think when hospitals and practices are trying to implement AI, those are a lot of the things that have to be considered. So did that answer?
Yeah, I'm going to throw it back on Alex and get Alex's perspective.
Yeah, I mean, what was the question again? I apologize.
Yeah, we were talking about what do you see in the future and how AI can have a positive impact as we move down uh, a few years
Yeah.
from now. I'm asking you to predict the future. Sometimes
Yeah,
people like
yeah.
to do
So
that.
I
Sometimes we
think
really
it's
don't.
going a lot more into an agentic kind of model where the AI is not just recommending what to do, but it's actually taking actions on your behalf. Um, of course, with your permission. Again, that's where it comes to kind of policies. There's going to be a lot of policies designed around how we work with AI in that sense, and what powers we give the AI agent.
This is gonna be kind of off the wall, but like I kind of have a visualization. I'm fixing to date myself too. In the 80s, there was that movie Short Circuit. You remember that? And you had Johnny Five who could take a book and he could flip through it really fast and read everything and understand it. Well, you just mentioned the code book. What if you could take, the ICD-10 or the CPT code book and feed it into an LLM and it know everything and understand everything about it in a matter of, seconds or minutes, and then start asking questions without you having to flip through that book. I mean, that's kind of what you could do that with payer policies. You could do that with CMS billing guidelines. And so that's really where, how I kind of put a visualization to what AI is doing behind the scenes. And of course, there's all the databases and vectorizations and everything behind it. But that's really how I visualize that for the future. Sorry, that was silly, but I just
No, that was actually probably one of the most insightful parts of the whole conversation we've had today. So I appreciate that.
Oh, I'm
Reese.
sorry. I apologize.
No, it was good. Um, yeah, one final question, and then we'll kind of open it up to the team. How do you see Sliced Health being different? And you can break it down from corporate philosophy to you guys are the visionaries when it comes to product development at Sliced Health. What differentiates Sliced Health from what you've seen in the marketplace and what you're hearing?
Who's
Yeah, I
first?
think on the RCM side, most people that are approaching AI on the RCM side are not don't have a contract management system. So we're kind of lucky in our positioning where um, this is a perfect evolution of a contract management system, really.
Yep. Yeah, absolutely. So, where a lot of platforms may look at claims data and remits data, we also apply that third piece of the contract to make sure that it's being compliant with your payer contract. I think one thing about Sliced Health and why we went down, we didn't do it to be impressive. It's kind of the buzzword now. I think we're trying to build it to actually be useful and to help our clients and make sure that it is being utilized to explain what's going on within that contract knowledge. We try to make it traceable to where you're able to see the thinking behind it and be very thoughtful in how we present that back to the client. And then it's being built with a lot of people involved who understand RCM. And so it's got that human expertise built into it as well, where we're looking at it saying, no, we don't like that. Let's augment the prompt to where we get something that's more useful, or let's make sure that it's going to not just return a bunch of information, but that information is actually useful, because we want it to be something that can be trusted, and not just there as a kind of a vanity piece, I guess is the best way to say that.
Fantastic. Wondering if we have any questions that have been posted. Looking to see if you have any, please go ahead and submit those in there, and maybe we can go ahead and address some of these. I have one here. I'll put it up to both of you guys. Can you share any real life examples of how AI has positively impacted revenue or risk of recoupment for healthcare providers? Some real life examples.
Yeah, I mean, we're still, fairly early in our life cycle of this. But we've already seen places where it's identified, where certain procedures have, it's one thing to come across to claim where this happened one time, but then you could very easily find where it's also happened 10 other times or 20 other times. So using it to find those things like modifiers we mentioned before, and where diagnosis codes are being used associated with certain procedure codes that haven't necessarily, that are always getting denied. And you may be able to run reports and see that, but you kind of have to think through it, where the AI has just kind of presented it and be like, oh, hey, by the way, this is happening. So, we've seen that already in some of our testing. And then really, it's interesting to upload a contract that is 160 pages worth of data, where 90% of it is legal jargon, but it immediately finds the things that you should question and or consider changing in a future contract. So we're using it in two different places right now, for the contract and then for the claims analysis and variance patterns. So we've seen very useful results in both of those areas already.
Yeah, and I guess, are you able to compare contracts as well?
Yes. Yep. Yeah. So we've built it to where if you have, we have 10 contracts built with 10 different payers, you can almost kind of say what's really, the sky's the limit on what you can ask it. You can say, how does this contract labs compare to this contract's labs? And it'll, tell you, oh, this one pays 93% of CMS, and this one pays a certain percent of fee schedule. And if it has those fee schedules available to it, it can also kind of compare how those are paying as well. And, same thing with looking at carve outs and lesser than logic. And, a lot of them will say, okay, well, we're going to pay 90, we're going to say pay a certain percentage of this fee schedule, but it's got $1,000 cap on it. Well, if you're getting something that should be above it, then that cap is actually kind of killing some of your reimbursement. So things like that it finds that you would maybe normally skim over, it brings those directly to your attention, and it may make you actually think about, how your contracts are written a little differently.
Yeah, I think there's a huge opportunity right now with contract renegotiation. The advent of price transparency data really can enable providers today to negotiate it on a much more competitive basis. So I think there's lots of advantageous scenarios where the platform can help provide value into both of those. We are at the end of our presentation and our panel discussion. I would invite the attendees. We will be posting this webinar on our website. I would invite you all to visit our website. If you want to download a copy of it, you can get a copy of it there, or you want to share the information that was shared today. I want to thank Alex and Reese for their time. Thank everybody for attending. SlicedHealth is doing a lot more of these webinars, so please re-register. If the topic resonates with you, please sign up. We'd love to have you come back again. And if you have any further questions, you can address those off of our website as well. But once again, thanks everybody for your time, and we look forward to seeing you next time. Have a great day.
Thank you.
Thanks, David.